You are welcome back to the fourth episode. In the last episode, we introduced the second terminology, mental distress, and we are able to explain that mental distress is when somebody is actually suffering from overwhelming stressors. We have also explained that stressors are normal things that every one of us experience in our lives. Even the rich people also have a lot of stressors, and somebody who is enjoying good mental health move into mental distress, which are normal psychological responses. But when these stressors are overwhelming, the person will move into mental distress. When an individual is in a state of mental distress, the functioning of the individual is significantly reduced. For example, if somebody is a student, there may be difficulty in going for lectures or writing, doing assignments. And if the person is a worker, there may be some days of absenteeism from work. Now, mental illness is actually a clinical condition. It can only be diagnosed by mental health professionals. And we have different types of mental illness. The common one that people are familiar with are depression, which we use loosely. Some people will just have slight discomfort in their emotions and they will claim they are depressed. As a lay person, you cannot make diagnosis of depression. So when we say mental illness, it's a clinical condition that can only be diagnosed by mental health professional. Apart from depression, we also have what we call anxiety disorder. We have others that are popularly referred to as bipolar, and we have another one we call mania. We have schizophrenia. Then we also have various types of personality disorder. Then we also have others like post-traumatic stress disorder. So when somebody is having mental illness, the hallmark of all these disorders that I've mentioned is that there is significant loss of functions. If the individual is a worker, there will be a long and persistent period that the individual will stop going to work. If the person is a student, the individual who is having